So thank you very much for that, Patsy. So I am one of the coordinators of a community health board in Nova Scotia. There's 35 community health boards in Nova Scotia, and there's 17 coordinators that are supporting that work. Um, we are our volunteers are non. We're Our volunteers are working in community to kind of partner to improve the health and wellness of the close to home, utilizing the population health promotion approach. We focus on the many factors, the determinants of health that affect the health and wellness of our communities. And then we share what we learn about the health and the community health and wellness priorities with Nova Scotia Health, the IWK, and community groups as outlined in the Health Authorities Act. So we are mandated by the Health Authorities Act to be the voice in community around what's happening in terms of community health priorities. So what I wanted to do was what Patsy's asked me to do is just kind of share. So in the last couple of years, we've had a small cohorts of our coordinators take the training with Patsy, the program. And so once we've had a couple of cohorts of people go through that, the coordinators decided that they would meet together, those who had taken the training, and kind of say, okay, the training was great, but what are we going to do with it? So we kind of talked a lot about how could we share what we've learned with other coordinators who didn't get to take the training, and then what were we going to do and how is it going to reflect into the work that we currently do. So when we looked at how we were going to share with the coordinators, we decided to do up a kind of a one pager. So it kind of allows us to kind of showcase the circle and use some of the language that we use in our work, and then to kind of give some examples of how the work that we're doing is actually being reflected in the circle. So we had this one pager, and then we had an online Zoom kind of training where we invited all the coordinators to come, and we kind of gave them an overview of what the circle is and how we think it could be relevant. A lot of the wording that's on the circle are the types of things that we deal with. We talk about the Ottawa Charter, we talk about the social determinants of health, but as a group of volunteers, it's sometimes difficult for us to use some of that terminology with our volunteers because they come from all different types of walks of life. So we try to make it in the simplest forms that we can so that they can help us with the work that they're doing. So after that, we decided that we maybe should sit down as a group of coordinators and kind of talk about, okay, if we understand what the circle is and how we could use it, what parts of the work that we're doing could we be using it more steadily in? So we were able to get together it was just in November of last year, and we used a couple of case studies that the coordinators came up with that were relevant to our work. And we sat down in groups and kind of went through how could we use this case study to talk about the circle and explain the circle, which I think was really helpful for people to kind of understand from the work that we're doing and how it can be interpreted through the circle of health. Then we broke up into groups and kind of looked at if we were going to use a circle of health to do two things, particularly was we give out wellness funds every year. All of our boards give out funds to community groups. And one of the criteria is that they have to be a health promotion kind of work. So sometimes it's hard to say, is this a health promotion? Is this not health promotion? We are trying to encourage our boards to think about things from an upstream kind of approach instead of too downstream. We were trying to figure out if this circle had any applications to being an assessment tool for when we were looking at our wellness funds. And the kind of consensus from the group was it might not be a great tool to use to assess every application because some boards get like 100 applications. So to use the tool, physically use the tool to kind of say, okay, well, does it match this and what are they saying about this and that sort of thing. It might be onerous for the board members to do that, but as an overall kind of better understanding of what they might be looking for within the wellness funds applications, we thought it'd be a great tool to showcase to them before they started assessing so they could kind of think about these things as they're working through their assessments. The second thing, we're doing community health planning right now in communities. So every 5 years, we're mandated to do a community health plan. So we're engaging with community. Once our engagement is done, we'll have to start looking at defining what our community health priorities are. So we wondered if there was an opportunity to use the circle of health to kind of help us decide on the health priorities and what the recommendations might be under each health priority. And the discussion, although not completed, was really around the group sees some application to using the circle when making when facilitating conversations that we need to have when the groups are deciding what their health priorities are going to be. So we looked at having a session around the values to make sure that everybody was on the same page about what our values are in terms of deciding our health priorities, making sure that people understood what the social determinants health and some of the interactions between them. Again, the population piece is, we need to ensure that the work that we're doing is staying at the community level and less at the individual level. And then, what are the strategies we could be using? So once we determine what these health priorities are going to be, what strategies could we be implementing to do that work? So after that session, it really was a decision by the group that we needed to kind of add the Circle of Health into our health promotion workshop that we offer for our volunteers. And we do sporadically offer these health promotion workshops. We just come together in 2015 as a provincial entity. So we are now doing a lot of things way more provincially. So we're starting to offer these sessions, workshops around the province. So a coordinator in Central Zone, for example, would host a workshop and do it, and anybody across the province could attend rather than me just doing a workshop just for my board. So I think there's going to be a lot more opportunities across the province to host these kind of workshops for all board members to attend. And this health promotion workshop, which we've held in the past, we're talking about revising it a bit to include the Circle of Health, which helps us to encourage and explain some of the concepts that come up in health promotion, as well as the health pyramid, which we also like to show people as well, because it helps people see kind of the upstream sort of pieces, and trying to keep them thinking about the community and the broader perspective than the individual. So in a nutshell, the story is still that we're trying to look at ways that we can use the circle. We think that there's some opportunities to educate our volunteers, particularly first, and get them using the circle in different instances, and potentially using it more formally for other purposes.